looking good there. Not palpable. I don't feel your kidney, which is a normal finding. So I'm gonna reach over you. I'm gonna lift your rib cage up again. I'm gonna feel the same thing for your kidney. Okay. Okay. So your kidney is not palpable. Can you give me a deep breath? Okay. You can breathe out. Okay. So that is a normal finding. Okay. So the next thing we're gonna do is we're gonna check out your spleen, okay? So your spleen can be with your other kind of mixed up with your other organs, but we're gonna check it out, okay? I'm gonna assess this one more time. Okay, I'm gonna assess this one more time. Okay. So the next thing I'm going to do, I'm going to be deep palpating your umbilical ring. So we just want to make sure it's circular, it's complete, it's symmetrical. Okay. That is exactly what I found. Smooth, complete, symmetrical. Okay. So we're going to do something, I'm going to have you go and put your arm like this across your tummy. Okay. So what I'm going to do, I'm going to be checking to make sure there's no ascites or any fluid in your tummy, okay? So I'm going to be tapping here. Okay, no vibrations felt on this other hand, okay? So we're looking good. Okay, so let me mark that down. Okay, so we're all done with this. The last thing I'm going to do, I'm just going to kind of roll out some other stuff. So I'm going to have you straighten your feet out. Okay, I'm going to have you lift this leg. I'm going to kind of put pressure on your leg. Let me know if you have any pain here, okay? So why don't you lift your leg for me? Any pain? No? Okay. So now I'm going to have you bend your leg up. Okay, so I'm going to be supporting your leg here and here. I'm going to be turning your leg like this. Any pain in any of this area? No pain. Okay, that's good. Okay, let's note that. Okay, so both of those tests were negative, which is good. So we're done with your abdominal assessment. So now we can get that focus on what is right here. Okay, so I'm not going to press deep. I'm just going to confirm that you have pain. Okay, so light palpation. Okay, do you have pain there? Yeah. Okay. I'm not going to do a deep palpation. Okay, because I know it hurt you there. Okay, so now we're done with your abdominal assessment. We're gonna continue with, I'm just gonna make sure that your heart and lungs are okay, all right? So I might have you change into a few different positions, but I'm gonna be auscultating all this, okay? So I'm gonna be listening. So again, I'm gonna press firmly to get my diaphragm effect, and I'm gonna press lower to get the low pitch sounds, okay? So you can breathe normal. S1, S2 heard, no extra heart sounds. S1, S2 heard, no extra heart sounds. S1, S2 heard, no extra heart sounds. I'm going to lift your bow up a little bit, okay? S1, S2, no extra heart sounds. S1, S2, no extra heart sounds. So now I'm going to go in reverse. I'm going to be listening with the bell, okay? I'm going to be listening for any bruits or any other friction rubs or anything like that, okay? S1, S2, no extra hard sounds. 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 And lastly, S1, S2, no extra hard sounds. Okay, so now I'm actually gonna have you switch a couple different positions, okay? So first, I'm gonna have you lay on your left side.
Okay.
If you can turn around for me, just so we don't forget this, okay?
Okay.
So I'll move this for you. Okay, so yeah, I'll have you lay kind of on your side with your arm out. So this just brings all of your heart closer to my stethoscope. So I'm going to be doing the same thing, okay? I'm going to be pressing firmly for the diaphragm. S1, S2, no other sounds. S1, S2, no other sounds. S1, S2, no other sounds. I'm gonna actually go this way, okay? S1, S2, no extra sounds. S1, S2, no extra sounds. Okay, so now I'm gonna be listening with my bell to listen for low sounds, okay? S1, S2 only, okay? S1, S2 only, no other sounds. S1, S2, S1, S2, S1, S2. Okay, I didn't hear any friction rubs, any bruise, any other extra sounds, okay? So now we're done with that. I'm gonna have you actually sit here on the couch. And we're gonna do it one more time. We just wanna get it in all 3 different ones, okay?
Okay.
Okay, so we're gonna be pressing firmly. S1, S2, S1, S2, S1, S2. I'm gonna go down a little bit, okay? S1, S2, S1, S2. Okay, I'm gonna be listening with the bell. No extra hard sounds heard, S1, S2. No extra sounds heard, S1, S2. S1, S2. Okay, and both of those are S1, S2. No other sounds, no bruise or friction rubs, okay? So now we're almost done. Now I'm gonna just make sure your lungs are okay. So I'm gonna be going here on the front of your chest, on the sides, and on the back, okay? And then we should be pretty close to being done. Okay, so you can breathe deeply for me. You don't have to breathe fast. Breathe at your own pace, okay? So I'm gonna start here. Okay, you can breathe deeply when you feel my stethoscope at your chest. At your own pace. Perfect. At your own pace. Perfect. Perfect. Vesicular sounds heard, no adventitious sounds heard on inspiration or expiration. So now I'm going to be assessing the sides of your lungs. I'm going to get all of those lobes and especially this lobe here, okay? So can you raise your arms for me? You're not allergic to cats, are you?
No.
Okay. Breathe in. Okay. Okay, at your own pace. 2 more, okay? Okay, one more time. I'm gonna get this right lower lobe, okay? Perfect. Okay, no extra adventitious sound, just your normal vesicular sounds, okay? So now the last thing I'm gonna do, I'm actually gonna have you kind of shift to the side frame. I'm gonna check out your back. So yeah, kind of shift. You can shift this way. Okay. So I'm gonna move your hair. So same thing, just breathe when you feel my stethoscope touch your back at your own pace, okay? Okay, a couple more, okay? At your own pace. Okay, 2 more. Perfect. Okay, your lungs are cleared, no adventitious sounds. So let me mark this. Okay. Get this done. Okay. So it looks like we're all done with our assessment. You can relax if you want. So it looks like we're all done with our assessment.
Okay.
So as far as my findings,
You look at me, and I'm just gonna put my hand over, and I just want you to tell me when you see my hand. Yeah. Okay, I'll start back. Okay.
Yeah.
No. Okay.
Yeah.
Okay. And let's go up here.
Yeah.
Okay.
Yeah. No.
Okay.
No.
Okay. Alrighty. And now, now if you'll just cover your eyes, cover just one eye. Sorry, cover that eye, and now I'm just gonna do it one last time, and you just tell me when.
No.
Okay. And just do the other. One.
Yeah.
Okay. Alright, now I'm just gonna take a look at your eye. See, eyebrows. They're full. There's equally symmetrical. They look good. There's no scaling underneath. No lateral thinning. Looking at our eyelashes. They're full. They're facing upwards. Just looking at our eyelids, there's no edema. There is that, you can open up. When I pull down on our eyelids, I do see that swollen gland, that lesion, some erythema with that. No surrounding eyelid. Looks pink, moist. No tearing. Looking at the lacrimal apparatus, there's no tearing, no swelling, glands. Looking at the conjunctiva, sclera, the white, some vascularity, no nodules, no swelling. So that looks good. Now, going to get my light. I'm just gonna look with the light, just look at the lens. Okay, I'm just gonna look full. Blinding you. Okay, and just looking at her pupils, they're equal, round, and about 4 millimeters, and reactive to light, and about 3 with light. Okay, irises look good, round, good color. Okay, now I am going to check her extraocular movement, look for her conjugate gaze, check for any nystagmus, any lid lag. So I'm just going to have you look at me. Just look at this pen, okay, and just follow it. Don't move your head. Okay, go up, then kind of do an H, and now I'm going to have you follow it. Okay. So that's good. I'm just going to take a look. So just looking at the auricle, looking at what I can see on the external. Same thing on the side. No erythema, no swelling, no obvious lesions. Now I'll palpate it. Just gonna go up and down, tugging on it. Any pain? Okay. I'm just gonna feel back here behind the ear on the mastoid. Any pain down there?
Nope.
No I don't feel any swelling. Not complaining any pain. I'm just going to Okay, no pain there. Okay, perfect. Now I'm just going to take a look. This good. Pull up and down. Okay, clear. I don't see any human. Good come to light. Good. Pearly white. No discharge. No erythema. Looks good. The same thing. External canals clear. Tympanic membrane there looks clear. No curcumin. Good color light. No discharge. No erythema. Pearly color. Now I'm just going to do some hearing tests. So I'm going to do a whisper test. So I'm just going to stand behind you. I'm going to whisper a combination of a few letters and numbers, and I just want you to repeat them. So I'm just going to cover this ear. Okay.
6-4.
Okay.
B1R.
Okay, perfect. Alrighty, so that's intact. So there's no need to. She's not complaining of any hearing loss, so there's no need to go on the special tests like the Weaver test or the Rhine test. Notice anything unusual with your breathing through your nose? Any pain? Any discharge? Any swelling? Any difficulty breathing? Okay. Have any bleeding? Awesome. Perfect. Well, I will just take a look. So it's symmetrical. I don't see any deformities. No swelling. No erythema. Looks good. Just gonna start palpate it. Is that tender at all? I don't feel any masses. Feel on the side. Feel the cartilage. I feel okay, no tenderness, okay, I don't feel any masses, any deformities. Just gonna feel the frontal sinuses. Does that hurt? Any pain there? Okay. Now the maxillary sinuses, any pain? Okay, I don't feel any swelling and anything unusual there. Alright, and now we are going to take a look up. So get this. How you look up. Okay, terminate. There are no polyps. Mucosal lining is pink, moist. No perforations in septum. No deviation in septum. So that looks good. No erythema, no, like I said, no polyps. That looks good. No bleeding. I'm gonna check the mouth. Have you noticed any lesions, any cavities or tooth pain? Okay. Are you missing any teeth? Okay. Have you had any sore throat?
No.
Okay. Alright, we'll have you open up. Okay, just gonna check inner lips. Lips look just good color, healthy, moist, no blisters, lesions, anything like that. Third line, just take a look. Let's see, good dentition, no cavities. You can see that looks good. I don't see gums. I don't see any lesions. Okay. You say ah.
Ah.
Okay. Uvula's midline. tonsils absent bilaterally. Mucosal is pink, moist, no erythema, no swelling. So that looks good. So one more time. Okay, hard palate intact, no lesions. Say out again.
First, I will start off by assessing his head and scalp. Then I will move to his face and assess facial features and his cranial nerve 7, which is the facial nerve. So when you open your mouth, puff out your cheeks, raise your eyebrows, close your eyes. Okay, and then I will assess his sinuses. So I'll assess his frontal sinus and his maxillary sinus. Then I'll proceed to assess his temporal mandibular joint when you open and close your mouth. And I'll assess his temporal muscle. You clench your teeth, which is assessing cranial nerve 5, which is the trigeminal nerve. Okay, and from here I will be assessing his lymph nodes. So you have the parotid, pre-auricle, post-auricular nerve, anterior cervical, posterior cervical, occipital lymph node, and supraclavicular. I have the submandibular and the submental and the tonsilary nerve. Okay, and that will conclude the head portion, and I'll proceed to his eyes. I will assess and inspect his eyelashes, eyelids, sclera, conjunctiva. You open your eyes for me. Okay. I will assess his lateral ducts. Okay. And then from here, I will assess his extraocular muscles. I'm going to have to stand in front of you. Will you just follow my finger, okay? And this will be to light and accommodation, both direct and consensual. Okay. Sorry. From here, I will assess his visual acuity using a Snelling test, and after that, I will assess his visual field by the confrontation test. So, Mr. Larry, can you put one hand over your right eye? And then I'm going to put up numbers, and you tell me what numbers that you see, okay?
1, 3, 2, 1, 1, 3, 2, 1, 4.
Okay. And this assess cranial nerve 2. And then I will perform my ophthalmoscopic exam. All right, so Mr. Larry, this might be a little uncomfortable. My goal is to assess vessels, his macula, and assessing for the red reflex. I'm sorry.
That's right.
I'm sorry. Okay. Okay, we'll do the same thing on the other side. Now we'll move to the ears, and I will assess his auditory acuity. So I'm going to press down on your ear to kind of occlude your hearing, and I'm going to whisper a word. You tell me what you hear, okay?
Cat.
Okay? That's correct. Okay, Okay, and then that assess cranial nerve 8, which is the vestibulocochlear nerve, which is cranial nerve 8. And then from here, I will perform the Ryan's test to check for any laterations in hearing or hearing loss. Okay. Tell me when you stop hearing the vibration.
Stop hearing.
Okay. Tell me you stop hearing the vibration.
I stop hearing it.
Okay. So check the other side.
Stop hearing it.
Okay. And then we're going to do the Weber's test. So I'm going to put it at the top of your head. And when you stop hearing the vibration, I'm going to put it on the side of your ear, okay?
Okay.
Right here. Okay. Next, I will be inspecting his ear canal using my otoscopic. Make sure it's on. I'll be completing my otoscopic exam now. Okay. I'm looking at the canal and the tympanic membrane. No abnormal findings. I'll also palpate and inspect his ears for any pain or tenderness. No pain, no tenderness?
No, ma'am.
Okay, that includes the ear exam. Then I will move to his nose. I will palpate and assess his nose. Pain or any tenderness? No. Okay, I'm gonna get you to smell something. You tell me what you smell, okay?
Lemon.
Okay, that's correct. You can open your eyes. This is assessing cranial nerve 1, which is the olfactory nerve. Okay. Next, I will move to the throat, and I will be assessing for his trachea for any deviation, and then I'll assess the thyroid. You swallow for me? Okay. Perfect. I'll be assessing your accessory nerve, which is cranial nerve 11. So will you shrug your shoulders? Okay. And press against my hand for me. Okay. Next will be his mouth. It's the next assessment. So I'll be inspecting his lips. Will you open your mouth for me, Mr. Larry? Looking at his teeth, gums. You stick your tongue out for me. Hold your tongue up. All right, stick your tongue all the way down, out and down. Open wide. Say ah. I'm looking for his uvula, which is his glossopharyngeal nerve, which is cranial nerve 9. You stick your tongue in and out, which is his hypoglossal nerve, cranial nerve 12. And then I'll also check his gag reflex, which is cranial nerve 10. Okay? Okay. Now I'll be checking your reflexes. Okay? Let's do this arm first. Okay. Can you hold your arm out for me? Do that one more time.